So I'm Dr. Sanjeev Jain. I'm a joint replacement surgeon at Dr. L.H. Hindani Hospital, Powai, Mumbai. And I've been practicing joint replacement for last 33 years. I have had my all kind of training in a best to best center in the world with the topmost surgeon amongst Dr. Dholakia, Dr. Ranawat, Dr. Insol, and many, including in Harvard with many of the surgeons. And I really want to thank all the teachers to bring me to this stage. So there is always revision. THA procedure is like a remarrying. It's not like a primary marriage you do it. Okay, so that means when you do a first time hip replacement surgery, it's quite easy to do it. Again, I'm talking about the simple hip surgery in a primary scenario. When you have a difficult hip scenario, it is as good as a revision surgery. So in revision, what happens is there is two components. One is an acetabulum and one is a femur component. And of course, between the two, there is a ball which is made up of either the ceramic or made up of either the cobalt chrome. Now, what happens in the revision? One of these components get loosened out, and because of that, there is a lot of osteolysis which happen around the bone, and of course, the implant gets loosened out, and it's very difficult for a person to walk without any pain. So if it is done in an early stage, it could be an early revision if detected. If it's a late revision where there's a lot of bone loss because of the osteolysis, which happens because of the particular debris, the problem will be really bad. And if you have to do a cemented implant to be revised, it may become sometime easy. But if there's a uncemented hip which is inside and the polyethylene wear out is there and a lot of osteolysis, and implant is good on the back side and we need to revise the whole implant, then it becomes a nightmare to do it. So it perceives like the same thing, like if somebody tells me to fly to the moon and somebody wants to fly me from Visakhapatnam to the Mumbai. So if I'm flying to the moon directly from here, I'll perceive totally differently. So when the robot is there, naturally the person has a perception that is going to be very highly precise and accurate surgery, and that's what the patient feels. We have been doing computer navigation for many years, but the patients were not very attracted to this word. When a robot, ROBOT, comes in the picture, the patients are really attracting and they feel that it's going to be super duper and very accurate and long lasting surgery for them. Question is that why the Indian company has taken it up. Simple reason that we have no Indian company who's got such an advanced setup, one of the things, and to build up the own implant here in their own factory situation with the same international standard, getting FDA approval, and of course doing for their own patients, and also the bringing down the cost in the primary hip only situation or a revision situation of the knee or a hip. I think that's a great innovation in a joint replacement surgery.